A very good evening, everyone. I'm Khatija Binti Abdullah, and today I'll be presenting on communication and counseling skill for nurses, oral presentation. I'll begin my presentation from contents, which comprise of introduction, therapeutic communication and counseling skills, definition and importance, application in chronic illness, strategies to enhance communication and counseling, conclusion, and lastly, with references. Effective communication is the cornerstone of quality nursing care. Therapeutic communication and counseling skills build trust, provide support, ensure patient understanding, and foster a compassionate, patient centered approach. These skills ease distress, encourage treatment adherence, and enhance well being, especially for chronic illnesses. Counseling guides patients through lifestyle adjustments, coping, and decision making, like helping diabetic patients manage changes. As for key communication strategies, active listening shows empathy and helps patients feel heard. Using simple languages ensure clarity, while cultural sensitivity respects patient beliefs for personalized care. What is therapeutic communication? Therapeutic communication is the purposeful use of communication techniques by healthcare professionals. It aims to establish rapport, convey empathy, and provide emotional support involving both verbal and nonverbal interactions, promoting patient well-being, as cited by Vinita 2022. Whereas counseling skills in nursing involve structured conversations to help patients cope with emotional distress, make informed health decisions, and manage chronic illnesses. Key skills include active listening, reflection, paraphrasing, and problem solving strategies. What are the importance of effective communication? Effective communication and counseling skills are essential for quality patient care. They involve actively engaging with patients to address their emotional, psychological, and physical needs, going beyond basic communication. Not only that, it is important to building trust and rapport. Establishing trust is fundamental. Patients who feel heard and understood are more likely to share concerns openly. Techniques like active listening, empathy, and non judgmental responses create a safe environment for vital and vulnerable patients, as mentioned by Zhu and Heffernan 2021. Not only that, it is important for patient satisfaction. Patients experiencing compassionate and effective communication report higher satisfaction. When nurses therapeutic communication, patients feel valued and respected, leading to a more positive healthcare experience, crucial in areas like palliative care. Another importance is treatment adherence. Many patients struggle with treatment adherence due to misunderstanding, fear, or misinformation. Counseling helps nurses educate patients on their condition and the importance of following medical advice, motivating adherence to treatments and lifestyle changes. Apart from that, it helps in reducing anxiety. Patient often experiences fear, stress, or depression. Therapeutic communication alleviates these burdens by providing comfort and reassurance. Simple actions like eye contact, calm tone, and validating feelings make a significant difference, as mentioned by Hussain and Nuraria 2024. Adding to that, it also adds values to team communication, where therapeutic communication is crucial for teamwork among healthcare professionals. Effective communication ensures seamless care, prevents errors, improves delivery, enhances collaboration, and reduces workplace conflicts. Adding to that, it adds importance to patient-centered care, where patient-centered care tailors services to individuals' needs, values, and preferences. Therapeutic communication achieves this by active listening, involving patients in decisions and respecting autonomy, leading to better engagement and outcomes, as mentioned by Ritchie et al. 2021. Last but not least, the important is family involvement where chronic illnesses affect patients and families. Strong communication skills help nurses support families, educate them, and guide them participation in care. This improves patient outcome and ensures long-term support, as mentioned by Ostergaard et al. 2022. Moving on to this slide, by how it is being applied in managing chronic illness management. Therapeutic communication is vital for managing chronic illnesses. It fosters trust, understanding, and collaboration, guiding patients through the physical, emotional, and psychosocial challenges of conditions like diabetes, cancer, and hypertension. Now, I'll talk about how it is being applied in diabetes management. Diabetes requires significant lifestyle changes. Therapeutic communication addresses challenges by providing emotional reassurance, by acknowledging feelings, empowering self management, setting realistic goals, and simplifying complex information, clear language, and by visual aid, as mentioned by Ferreira et al. 2021. It is also applicable in cancer care, where cancer presents complex emotional and physical challenges. Therapeutic communication supports patients via active listening, creating safe spaces for expression, emotional validation, acknowledging feelings without judgment, and facilitating psychosocial support where connecting with support groups, as said by Siragar et al. 2021. It also promotes resilience in cancer care, involving empowering patients to focus on controllable aspects like treatment adherence and self-care. Therapeutic communication instills hope by discussing realistic outcomes and celebrating small victories, as said by Crawford et al. 2021. Now I'll talk about how it helps in hypertension management. Hypertension management often involves struggles with adherence and lifestyle changes. Therapeutic communication supports patients by addressing concerns, educating them, and empowering health control. Even though it is important and it is vital in hypertension management, it is not easy to begin with. First of all, we have to start by building trust. Building trust is the first step. Many patients feel anxious or skeptical. Active listening, empathy, and reassurance create a supportive environment for discussing fears. Example, acknowledge concerns about medication side effect calmly, as said by Alande Cuso et al. 2021. Patient education plays a very important role as well in hypertension management and other important management of the other diseases too. Many patients lack of knowledge about hypertension risk. Counseling helps provide clear, simple explanations. Example, explain why daily medication is vital even without symptoms, as high blood pressure can damage organs silently. Moving on, family support is also important in hypertension management. Family support is crucial. Use therapeutic communication to educate patient family member on assisting with management like preparing healthy meals or encouraging activity. Example, involve spouses in dietary discussion suggesting low sodium. Trusting relationship also plays vital role in hypertension management. The foundation is a trusting nurse-patient relationship. Trust is vital for chronic illness management, helping patients feel valued and understood, encouraging engagement in care, as said by Becker et al. 2021. Just like how plants don't flower in a day, all matters need strategies for patient-centered techniques for beginning with. Patient-centered communication tailors care to individual needs and preferences. It fosters respect and collaboration, empowering patients in their healthcare. Example, explain procedures simply, address fears, and involve patients in treatment planning. Another strategy that often helps role playing and demonstration. Interactive methods like role playing and demonstrations enhance understanding of procedures, self care, and lifestyle changes. Demonstrating skills, example on insulin use, clarifies complex concepts better than words alone. Not only that, role-playing method encourage active participation, allowing patients to practice tasks like blood glucose measurement under supervision. Hands-on learning provides feedback and improves self-care confidence. Example, demonstrate and guide inhaler use for asthma patients. Moving on, another strategy will be shared decision making, or also known as SDM, which is a collaborative process where nurses and patients make informed healthcare choices together. It empowers patients by considering their values and lifestyle in treatment plans, improving adherence and outcomes. For shared decision making, I would like to share an example where for a diabetic patient struggling with control, present different management options such as diet, medication, activity. Ask which approach feels most practical for their lifestyle and support their informed. Another important and helpful strategy in the current digital world will be digital health technologies. By integrating digital health tech such as telehealth apps, EHRs enhances communication and counseling, as mentioned by Leo et al. 2022. This improve accessibility, enable monitoring, facilitate education, and boost engagement and adherence. For example, on how digital health technology help for a hypertensive patient, use telehealth for check-ins, recommend apps for tracking BP, medication, and use EHRs for seamless communication among providers, improve care continuity. As for conclusion, therapeutic communication and counseling are fundamental for trust, adherence, and emotional support in nursing. They address physical, psychological, and emotional needs, especially for patients with chronic illnesses like diabetes, cancer, or hypertension. Proper communication is vital for empowerment and improvement as well. Active listening, empathy, and clear communication empower patients to manage conditions and improve quality of their life. The significance is clear in real world application like helping diabetic patients adhere to lifestyle changes and enhancing outcomes. Not only that, effective communication needs continuous development because it requires continuous improvement. Strategies like patient centered communication, visual aids, and ongoing professional development strengthen nurses' ability to provide holistic patient. From this slide onwards, I've included the references that has helped me to complete my writing and complete my presentation as well. Finally, thank you for listening. I hope this presentation has provided valuable insight into importance of communication and counseling skills in nursing and how we can address them in our daily practices. Thank you.